This next series is going to be bed exercises for your knee and your hip. Very simple. Just going to be laying down here and doing what we call a straight leg raise. And that is just lifting the leg straight up. You could have an ankle weight to make it more difficult. You could change the position of your foot and your leg. If you rotate your leg out and you come up, you're working a different area than if your foot is inward. It's a good way of working different fibers of the same muscle. That's the straight leg raise. For just the knee, you can put a ball or a pillow under a bent knee and work on just kicking straight from here. Again, you can add an ankle weight just to make it a little more difficult for yourself. Good. You could also take a band and do a leg press. You put this on your foot and you just kick forward. Then you are kicking with the leg press. This works the quad. Changing the foot position again will change your emphasis. Good. You could also do some exercises with the inside of your hip, just lifting up. So you're lying on your side here. You could have this foot either forward or back, and you're working the inside of your groin, inside of your leg. Either way, whatever's comfortable for you. Now if you work the outside of your other leg, just lift the leg straight up. There you go. That's working the abductors. And this one is the adductors. Groin, outside of thigh. Again, add an ankle weight if you need more resistance. Today we're going to be talking about strengthening the knee using a band. Very simple. You attach the band to a sturdy object. At the end, if you want, you can tie a loop so your foot can fit through. It makes it a little easier. Otherwise, you could just make a giant loop around the object it's attached to. That's the easiest way of attaching. So, to begin these exercises, you're going to put your foot through here. But before you do that, I just wanted to demonstrate what I just did there, was wrap it around the object a little more to make it a little more difficult. If you feel like your band is a little long, wrap it around your object, and that can change your tension so you can make it a little stronger. So here, I put my foot here. Let's do the left. This will show how you strengthen hamstrings. But you can, again, wrap it around your pole or move your chair back to change your tension. And all you're doing here is pulling your knees straight back. You're going to feel the muscle behind your leg, the hamstrings, tense up. That's a hamstring. Right there. 3 sets of 10. Good. Very simply for the quadriceps, all you have to do is switch your chair around. You switch your chair around, you grab your band, put that on your foot, slide up in your chair, and here we are. We just kick. There we are working our quadriceps now. Right there. Good. 3 sets of 10. If you wrap it around your foot, you can make sure that it doesn't slide when you kick. These next few hip exercises are going to be for your rotator cuff of your hip. Now a lot of people don't even know that they have a rotator cuff of the hip. But these exercises are crucial with hip instability, and we will be giving them out often. It's very important that you do them correctly. This is why we started this video series. But again, attach your band to a sturdy surface. Have a nice loop here for your feet. You wrap the band around your foot. You keep your knees together. What you're going to do is, while keeping your knees together, you're going to pull your foot through. So I have to move my other leg backwards in order to make sure that this leg can go past it. Think of this as a clock. This is the part that stays still. Your knees stay together. You can hold them together so that they don't move. And here we are, just working the hip rotator cuff. Right in like that. Now that's what we call external rotation. To work internal rotation, I would switch the chair around and I would pull the opposite way. But for demonstrations purposes, I'm going to show you what internal rotation looks like on the other leg. So if I flipped around the chair and did this exercise for the leg I just did, we'd cover that. So see, this one I'm pulling out. The other one I was pulling across my leg. This one I'm pulling away from my leg. I start with my legs crossed and then I pull out. This is internal rotation. You want to cover both motions when you are working the hip for dislocations and instability. Internal rotation, external rotation. This exercise is the knee bend, how to safely do it. A lot of times people go too far, they lose sight of their feet, and they can actually cause a little more damage. But to begin strengthening the quadriceps here safely, you want to slide along a wall, put your feet out in front of you. You should always see the tips of your toes, so as you slowly come down, you look at your toes, make sure you can see them, and then you come up. It's a small motion, you're not going far. Just slide down, make sure you see your toes, and come up. You can feel that white in the quadriceps there. Don't lose sight of those toes, otherwise you're bending too deep and you could be hurting your cartilage. You could use a ball to work some inside muscles of the knee, called the VMO. These get weak after surgery. You could use a pillow, and you can even, if you want to, just kind of use your hands. Pillow or a ball work better. Next set of exercises are knee step-ups. This is where we have a 6-inch step. We put our foot forward, and we work on building strength. Leave the foot up there. Come up, come down. Come up, come down. Up or down. You can change where your foot's positioned. You can move your foot a little outward and come up and down. Up and down. If you feel cracking or you feel popping, changing your foot position may make it feel a little more comfortable. Make that go away. Up and down. If 6 inches is too much, you take a thick book, put that on the ground, and you can practice coming up and down on that little book. So, here you go. See this little book? You just come up and down here. If a full step is too much. These exercises are plyometrics for the knee, meant to do quick start-stopping motions for when your knee is feeling much better. You want to have something for support so that you don't lose that. Because what you're going to be doing is you're going to be side to side like this, hopping on that bad knee, side to side. You can do it forward and back, side to side. You can do it far, forward and back. This is gaining knee stability. You could also work on doing it up to a step. Plyometrics.